we have established 3 standby isolation centers with an isolation bed capacity of 42. Hence, as of today, we confidently announce that we are ready to combat COVID-19 with a total number of 360 beds. This is over and above the 684 beds. Some mistake here, 684 beds for other diseases in Embu level 5. So when you add 364 beds plus 360 beds, there you have 1,040 beds only in Embu level 5 hospital. May I now take this opportunity, Waziri, to thank the people who have really helped us in doing what we have done so far. Starting with you, Your Excellency, the Minister. CS Health has provided us with already 2 ventilators, which we shall use in the children's ward, 150 full kits of PPEs, 20 thermoguns already, 10 oxygen supporting devices already received, 550 pieces of KN95 masks, 1,580 face shields, 400 protective gloves, 250 goggles, 50,000 shoe covers, allowance to frontline health workers of 48,465,000. So we are just working on those so that we can now give them the package. 245 healthcare workers under UHC program, 42 healthcare interns under UHC program. Waziri, being blessed for your generosity. Family Bank, 14 ICU beds of 4 functions, 51 isolation beds, again from Family Bank, 51 drips. Then Cooperative Bank has also supplied us yesterday with 10 isolation beds, and we have just seen them. In conclusion, Waziri, let us remind ourselves that health safety is personal, individual responsibility. And hence, let us always remember to wash and sanitize our hands, wear masks, keep safe, social distance. Prevention is better than cure. Thank you and be blessed. Now I take the honor to welcome Waziri Mutahi Kagwe to address the nation. Karibu and welcome again, Waziri, to Embu County.
Thank you. Thank you very much, Governor. Perhaps before I do so, I would like also to recognize that the Senator is here, and perhaps he can say something before I start. Senator.
Oh, can I to me, Governor? Wacha nikamate hii, labda ni baraka ya kona ingine. Waziri, first we want to thank you. My governor has already explained our position in Embu County. First, we want to thank God that amongst the counties which have and the spike in this epidemic, Embu County, we have so far been saved. Indeed, having gone through the hospital and the isolation places that we've seen, no one in those isolation counties. This is something that we need to remind ourselves. Indeed, and I don't want to say what you have always told the nation, but the truth is this: whenever we go outside this county to our markets and places, we are finding people who think that this COVID belongs to other places, not here. The only way that we'll be able to beat this epidemic, and I know this, Waziri, you have said many times, is for each one of us to imagine that this thing iko, yani uko nayo wewe, and for you to imagine that the person next to you is going to infect you. Once we get to that reality, then we'll be able to fight this disease. Indeed, Waziri, and I'm happy Commissioner is here and you addressed it earlier. In this country, we have pockets of people who behave as if they don't belong to this world. In some places, this afternoon, if you went to some places, you find fellows enjoying local brews. Wanatwanga kitu yao vizuri inside huko kwa vichaka huko. And you know, this is courting death. And I want to ask those people, whoever it is that is doing that, and wherever you are, please remember that ukuete korua atedio kohora. Hii maneno, when it is time for death, you just die, and there is no cure for death. So please watch out. We want to ask people, not just in this country, countrywide, that let us fight this thing. It is not enough to tell the president, open up, don't close. Open up, don't close. Now, when you are closed, we did very well. The day the thing was opened, now some of us who are beyond 40, those of us who are beyond 40, we are looking for holes to hide. Because you have seen, the thing has spiked all over, everywhere. Waziri, I want to request you that please let us have testing facilities in this place. Let us do that. We have had reports that most people in this country are asymptomatic. Maybe here, that might be the reality. Perhaps if we could have testing facilities in all places, maybe this pandemic, the reality of this pandemic will be real, will be realized, with our people. I want to thank you very much, Waziri.
Thank you. Thank you very much, Senator. From the outset, let me just first say thank you to the Governor, Governor Martin Wambora, and to say it's a pleasure being here in Embu. It's not the first time for us. We have been here before. And I just want to say that your welcome is appreciated. We were very, very, very warmly welcomed here, and I want to thank you and your government for that. As you know, we are undertaking visits across the country to just take stock of the level of readiness and to identify the gaps for enforcement as we intensify our efforts to safeguard public health. We cannot afford to rest on our achievements attained so far, as correctly put by Senator Peter Ndwega, because this disease is here with us, and it is spreading and ravaging our people in all the counties. This preparedness that we are looking for is essentially to invest in firefighting against the disease in the future. The activities of visiting and going around also give us an opportunity to motivate and encourage healthcare workers for their hard work as they handle the difficult assignments of fighting this virus. Fellow Kenyans, I'm very encouraged by the level of preparedness in most of the counties that we have visited so far. I must also acknowledge that not all counties are at the same level of readiness. Indeed, there are many who have met and surpassed the 300-bed isolation facilities that His Excellency President Uhuru Kenyatta mandated that we must have in each county as a minimum. Here in Embu, I'm very pleased to note that the county government, as has been explained by the governor, has already established over 360 beds in readiness for the management of COVID-19, and an additional 18 ICU beds. And indeed, not only are they ready, it's a great thing to see. It's just well done. And I want to congratulate the Embu people. I want to congratulate you. I want to say hongera. Hongera, in case the governor has assured me that in case anything else were to arise, he is also able to expand into other areas that are not necessarily in this. And this is a big hospital. You know, this is not a small hospital with over 1,000 beds, you know, inclusive. When you add all of them, you go almost to 1,000 beds, and that's a big job. And I want to thank you, Governor, because that care is not just for Embu County. It also serves, I'm told, very many other counties, all the way from Kitui, Kirinyaga, and the others. So, Asante. So this preparedness that you have, Governor, is beyond what the presidential directive was, and I want to thank you for that achievement. This is key, considering that Embu County has only two recorded positive cases, and is ranked actually at number 39 out of the 43 counties that have so far recorded cases. But the reason why we are here as a team from the Ministry of Health is to try and urge the Embu people to keep it that way. We don't compete for the higher number, compete for the lower number. So there is nothing to be proud of by saying how many, we are so many. We should be ready and we should be happy that our ICU beds, the COVID-19 ICU beds, are empty. The isolation centers here are empty. This is what we should be thankful to God. This is only because of the care and protection that has been there. And we have said, and I repeat, that because of the movement of people, the free movement of people now across the country, it is likely that you might find visitors who will bring it here, especially those people who are coming from Nairobi. I come from Nairobi as well, but you can see I'm keeping my... Na mtu wa Nairobi, mwambie akae kama mimi. Akae akiweka nini? Akiweka social distance. Akikukaribia, mwambie arudi Nairobi. Lakini ikiwezekana sana, people in Nairobi should stay in Nairobi. You are not, the governor is not actually welcoming you here. So, kaeni huko tu. But as has been mentioned, the fact that you have got only that you had had only 2 cases, I am aware that there are 21 persons in quarantine at the moment, but we hope that these ones will also turn negative. But this situation can easily change. So to provide comprehensive medical care to our people calls for additional accessories and skilled human capacity. And I'm glad that there is training, continuous training going on in this hospital. I'm informed that to boost its intensive care capacity, Embu County requires additional auxiliary equipment such as ventilators, patient monitors, infusion, syringe feed pumps to the existing ICU infrastructure.